are absolutely sold out on this work of the hands of these doctors. It's called upper cervical. I even like the name of it, you know. It's all based on getting our heads on straight. And I remember when I was a child, my mother used to say, "You better get your head on straight." I didn't quite understand what she meant or what she was talking about, but it's true. If we can get it on straight, the body begins to take care of itself. I didn't know any of this. I had no idea. I was kind of fat, dumb, and happy. I'm a business guy. We own a small telephone company. We're just clicking and going, and I just thought things were just wonderful. And had gone to a dentist. And if anyone's a dentist, I'm not saying dentists do this, but just had gone to a dentist and was getting some corrective surgery on my jaw. And after I left there, I was under sedation. I went and I'm at home, and the sedation starts coming off, and the pain really starts coming in my face. And so by the next morning, I couldn't hardly. I was absolutely debilitated. It was hurt so bad. And so I called the doctor. He's a good friend of mine. I called him and I said, "Boy, something's wrong." And he said, "Well, come on down." Went down. They reopened it up again, and he said, "It's probably just a dry hole or something. It's okay." Shot me with Novocaine. When he did, the pain went away, and that really felt good. Gave me more pharmaceuticals. That made me happy. So off I went, you know, but as that began to wear off again, that pain came back more and more. And that began a life that I had never dreamed that I would be involved in, a life of pain. I have a high pain tolerance. When I was a little boy, we'd play either cowboys or Indians or soldiers. In those days, I'm kind of old, so it was the Second World War had gone on, and so and I thought, you know, if one of those guys captured me, they could do anything they wanted to do to me, because my pain tolerance is so high. All I'm giving them is my name, rank, and serial number. Well, this pain is called trigeminal neuralgia, began in my face, and that pain began to take on a new life for me. I had to just concentrate on this from the moment I could get up in the morning until I went to bed at night. And then, being a Christian, I went to all different kinds of churches. I was looking for prayer lines. I was looking for any place that somebody could just say, "Let be healed," or whatever. I didn't care. And all of a sudden, bam, it would just stop. And I think, "Oh, wow, I've been healed. Great. Wonderful." And I'd get on about my business again. And about 6 months later, I'd be out checking our mail, and a slight breeze would touch my face. And boy, a spike of pain would come back, and then all of a sudden it would get worse and worse until finally I was bedridden. Now, that went on for 12 years. The last 2 years, the pain never let up. What's the pain like? Kind of like if you've had an exposed nerve in your tooth, and you happen to hit a nice piece of ice. It was like I had a whole mouthful of ice. And no matter what I did, that ice was hitting that nerve, and it wouldn't stop. It was atypical. It traveled around my face. It could be on my nose, in my mouth, on my tongue, in my eye, on my ear. It felt like a baseball bat. Bam! Except a baseball bat, at least the guy would have to bring it back and hit you again. This pain just stayed that way. It was like the hitting of the bat wouldn't stop. If it was on my tongue, it was like an electrode. Put it into my mouth and just stuck it onto my tongue, and my tongue would curl. I could not believe it. Now, I had no way of getting out of it. There was a medical procedure for $40,000 with a 20% where they'd put a Teflon tube around that nerve. It could cause you to go blind. It could cause it to switch to the other side. It could cause you to have drops here of the face to go down. It could cause you to lose all feeling in your face totally, or at least that side. And $40,000. And I didn't want any of those, and I didn't have $40,000, which is, I guess, not normal to be in that position, but I found myself in that position. I didn't have it. So I began to lose hope. And the more hope I lost, the more desperate I became, the more drastic my steps became, until finally the disease is called the suicide disease. In the 13th century, they'd slit open your cheek and pour acid in it to try to stop that pain. Suicide began to come upon me. It was like a bad dream. It would just keep waving in and out of me, to it's okay, commit suicide. And I began to pray about that, and I don't believe it was God's perfect will for me to kill myself, but I believe I got a release to go ahead and do it. And all I had to do was make amends with my children and my wife, and I'm gone. So being not crazy, I couldn't just grab the gun, and I had it placed inside our cabinet alongside the bed, grab it and shoot it quick. I planned it out. I knew exactly when I was going to do it, and I was so desperate. It was going to be a Tuesday at 5 o'clock in the afternoon. And I thought, geez, am I going to be strong enough to do that? But the pain was so bad that I knew it was worse than me not being strong enough to actually kill myself. So, when I talk about that pain, it's like a beast, and I'm still fearful of it. It consumed my life so strongly. On a Friday evening, I'm getting pretty. This is before the Tuesday. I'm getting pretty dangerous, and my wife is sensing that I'm getting pretty dangerous, and she's saying, "Now, James, we're out of food in the house. I'm gonna go to the grocery store. I'm gonna buy some, but don't you do anything stupid." And I assured her that I wouldn't. And off she went. And as she was gone, in the parking lot, a lady comes on. Her name is Luella Harris, in a wheelchair down in Florida, asking some very simple questions like, have you got pain that you've been told that you're just going to have to learn to live with? Have you got pain that perhaps they call it the phantom pain? It's just in your head. It really isn't happening. Are you suffering from some disease that there is absolutely no way out? If so, there may be a procedure that can help you. So gave an 800 number. Rhonda came back. She was so excited in the bedroom, went downstairs. She had told me about it, and I thought, she said it was chiropractic, and I said, well, that's good. I'd been to several chiropractics with this, trying to get this, and it wasn't working. And so, but I didn't want to make my wife feel bad. So I tried to encourage her. I said, that's good, that's fine. She went downstairs, called the lady, and she said, would you like me to have the doctor in your area, Oklahoma City, call you? And Rhonda said, would she do that? And she said, of course she will. And I thought, that's pretty amusing, a doctor calling you. And so she did. Saturday morning, she said, well, we're just moving into our new office, and they're putting in the x-ray, and it should be completed by Monday, so I'll take you Tuesday. And so Rhonda said, fine, we're there Tuesday morning. And she came upstairs really excited, told me that, and she says, yeah, and she can see us on Tuesday. I said, what time Tuesday? And she said 10 a.m. I said, oh, yeah, wonderful, let's go. Thinking, jeez, what a waste of time and money, but that's what we do. So Tuesday morning, she grabs me, we go up there, and we go into the office, and you can tell immediately that we're probably the first patient she's had, because it's empty. She's really sweet, real tall Norwegian gal, sweet as she can be, smile on her face. Says, well, let's see, we need to take some x-rays. And I said, okay. So she did. She took 3 x-rays, and then she said, can you just relax for a while? I need to read those x-rays and figure out what to do to get you on. And I said, well, what? Oh, sure. So she did that. And then she come out with a couple of x-rays and showed me these x-rays. And she showed my head was ajar. I mean, it was not on straight. And I thought, okay, yeah, okay, that's really a big deal. Yeah, whatever, I mean, every time you hardly look at anybody, if you see a picture of them or they're on TV, their head's off to the side. So I thought that doesn't seem like such a big thing, but not going to argue. So about an hour and a half later, she comes back out. We're still the only ones in the room. And she said, I'm ready. So she took me back into the room, and she adjusted